Hello, everybody. It is my honor to welcome Dr. James LaValle, pharmacist and nutritionist, and somebody who really doesn't need any further introduction, as what he'll say definitely speaks for himself. But before we begin, I'd like to announce his book, Peptide Handbook, for those of you who are interested in the nutritional space and in the peptide space, particularly about what we're going to be talking about today. This is the book that you need to get. And with that, I'd like to welcome Dr. LaValle.
Hey, how are you doing?
I'm doing well. It took a little bit of back and forth to get a hold of each other, but it was
Yeah,
worth the wait.
we had between the internet crashing and then man, we definitely we swam upstream for this, but I'm ready to go.
We did. And speaking of swimming upstream, talk about your journey into this space as a pharmacist, as a bodybuilder, somebody who was aware of this space but really didn't have an in to get full-fledged as you are now as a thought leader. Talk about your journey to learn about peptides and integrate that as an aspect of your career.
Yeah, it's interesting, man. I started out early, so I have 40 years in precision healthcare, right? I started in the 80s doing this work full time. And I think when I first learned about peptides, I was working on difficult cases all along. I guess I had a knack for unraveling people's chemistries and reassembling them into healthier human beings, right? No matter whether it was a professional athlete or somebody struggling with colitis or whatever the case was, just it was something I had a real passion for. But I remember with peptides, it was when I first found out about them, it was like this enormous, not I don't even want to call it a light bulb. It was a spotlight that went off that was, oh my gosh, this is transformational. This is adding a significant tool into the toolkit for healthcare providers, because I was already teaching at A4M. I was the academic co-chair for the American Academy of Anti-Aging Medicine. I had taught at the University of Cincinnati College of Pharmacy and Medicine, had a clinic where we were doing 300 to 400 people a week in
Wow.
precision health. I mean, we were in it deep, written 25 books, 5 databases. I absolutely love all of this space. But when I found out about peptides, it's like, wait a second, these are signal substances that our body should be making, but either because of age or infirmity, right? You get sick, you stop making something, you get an injury, you have a deficiency of these signaling compounds, or just because of the aging process, we start to lose our capacity, right? Because in the end, that's what happens. We lose capacity for our metabolic reserve, the way our metabolism is signaling our aging process, right? That's that whole process of metaflammation leads to inflammaging, right? And so if
Well said.
what really convinced me was, honestly, it was personal. My son had a Liz Frank injury his senior year of high school. And he was a two-sport all-state athlete in California, right? Top 30 linebackers in the country, full ride in football, signed. Second week of the playoffs in football, he has a Liz Frank. Now, if people know what a Liz Frank injury is, when that happens, usually your foot swells like a sausage, right? Well, I started using peptides on him the night of the injury. So I used back then, I used BPC, TB500, or TB4 basically, and then I used GHRP6, which you could get back then. Used basically a growth hormone signaling compound to help stimulate healing in that connective tissue. We go to get his images done for his Liz Frank, and we knew it was a Liz Frank. There was no doubt about it, right? They couldn't find it. They couldn't find where the injury was until the 7th set of images. And I literally had to call my former business partner, who was one of the leading, interventional radiologists in the country. He's written 14 textbooks on imaging. And he was in the outback in Australia. And I said, hey, we need to find my kid's Liz Frank. How do we need to position this? So we had him, foot a certain way. They do the image. They find that it's a hairline tear. You could barely see it. The inflammation had laid down so much. Now, it required surgery, two titanium screws, and what's going to happen then? The classic sausage foot in 12 to 18 months before return to play when you have a Liz Franck injury on your foot. And so we did peptides during the surgery and stem cells from his hip during the surgery. And then afterwards, we utilized stem cells or utilized peptides the whole time. In 5 months, he was able to win the California State Discus Championship,
Nice.
spinning and torquing on the injured foot.
Wow.
Now, that doesn't happen. I mean, I've talked to a lot of sports orthopedists, and they're just it's impossible. But I showed him the images, and I showed him pictures of the foot post surgery where there was no swelling. That was 15 years ago, right? And I'll never forget the power of that healing process. And since then, have had a lot of, I mean, incredible experiences with people. One individual that I got a call and, they went off a bridge with their mountain bike, broke their neck, had rods being put in their neck. They're in the ICU. The wife calls me and she says, we need to, what are we going to do? I said, well, here's a doc in your area, but consider using these peptides. And then, you get that phantom burning pain syndrome, from basically from the elbows down. And they said, oh, you're going to have that for 6 months. In 6 weeks, he was doing chin-ups in his halo with zero pain.
Wow.
Now, I didn't tell him to do the chin-ups. Video. I was like, what are you doing? Don't do that. I know you feel a lot better, but don't do that. But it's just been, it was those kind of things that I've seen along the way that were nothing short of amazing. So peptides are, for people listening, they're short chains of amino acids and they're smaller than proteins and they're signaling compounds that your body should be making. So, one of the big famous ones, for example, BPC-157, body protection compound, made in your gastric juices to protect your mucosal barrier. Well, it works on connective tissue, it works on helping heal your mucosal barrier, but it helps in general with inflammation in tissues. And so, your body makes these compounds, but because of injury or infirmity or aging, I don't like hearing the word aging, Medicare, in 2 months, I'm a Medicare patient,
Yeah, you certainly don't look it.
Yeah, well, yeah, thank you. But it is what it is when you look at my license. So, so the point being is, I think it created a tremendous opportunity to extend the care of people that are looking for precision healthcare, integrative medicine, regenerative medicine, to accelerate the healing process. Things that I would take months for me to work with in my clinics with my physicians, we're cleaning up in weeks. It was that big of a difference. So that's kind of the journey. Maybe my passion didn't come out on it, but I'm pretty passionate about it.
Yeah, no, for sure. That much is self-evident. I think for the medical community and for patients at large, when they're introduced to this concept of peptides, it's almost seen as this kind of unknown where they see it, they've heard of the value of it, but they're not quite sure how to approach it. I think GLP-1s have done a great amount of service in kind of elucidating the world of peptides. So from your vantage point, now that with the GLP wave coming and likely here to stay, what's next for the peptides? Are we going to see peptides for other conditions, peptides for other aspects of the inflammatory system? What are you envisioning for peptides as a whole, given the success of GLP-1?
Great question. Well, I always tell people, the very first peptide that was synthesized was insulin back in 1923. So, peptides aren't that new, but they're new to the public, and GLP-1s did kind of bring the biggest mass awareness to peptides. I think what we're going to see is this kind of acceptance of a lot of the peptides that were utilized over the last 20 years. So things like which is a thymic peptide, so from your thymus gland, which is very powerful for your immune system and has, had documented, case studies and even a few very nice publications showing its support in cancer cases and in autoimmunity, things for cognitive function, for healing, really important. I think one of the most important ones, like things like KPV, which is only three little amino acids, KPV, things that can help us address healing of the lining of the gut and the inflammation response in the gut. KPV downregulates an inflammatory compound called TNF alpha, which of course, what do we do right now? We use biologic drugs like Enbrel to do that. Well, what if we could have like a peptide that did very similar activity but didn't have the side effect profile or the adaptation problem, right? The tolerance issue that occurs with many of the biologics. I think there's a lot of benefit there. So when you think about it, everything from pain to healing the gut lining, reducing the permeability of the gut, to improving, downregulating neuroinflammation, to helping fight infection, to helping to repair tissues post-surgically, preemptively, like instead of a surgery, being able to heal connective tissue. That to me is the tissue anabolism, like build lean mass, reduce fat mass. I think that's important because muscle's the currency of aging. And obviously mitochondrial function is a biggie, right? MOT-SC, SS31, these are peptides that help us to kind of rebuild the capacity of our cells to generate energy. So there's just an enormous amount of benefit and potential for peptide.
Yeah, and I think the macro trends definitely favor the acceptance of peptides as a growing part of healthcare. You take the kind of post-pandemic reaction that the public has had towards healthcare, you take this move towards health and nutrition, and you add it all together, and I think that really bodes well for peptides and for this holistic approach to care. As you start to see patients who may have been unfamiliar with peptides before start to come and explore it, what are some of the initial questions that a patient will have when starting to explore peptides?
Is it safe?
Yeah.
That's the first.
Yeah.
Is it safe? I think there's a little bit, we always have the biohacking community where maybe they're injecting, 10 or 12 at a time. Hey, do I have to take a lot of these? I don't want to do multiple injections in a day. Are there any that are available orally? Is this temporary? Is it something I need to stay on forever? I think these are some of the key questions that I always end up answering. And I think when you think of peptides as signaling compounds, you almost can think of a seasonality to them, right? One of the big things that at least myself, I try to get across to people is this concept of, you're wanting to keep your body in homeostasis, pushing, for example, mitochondria, pushing the mitochondria to create tremendous energy all the time. Probably doesn't make as much sense to try to repair the mitochondria and optimize your mitochondria, take a break, move on to maybe thymic peptides to help recharge your immune system for a period of time. And then maybe you're moving to some cognitive concept with your peptides. So almost there's things that you might need all the time. For example, if you're a type 2 diabetic, you probably need a GLP-1. You're prescribed, maybe a medication you're on forever. At the same time, there's a population of people that could get on a GLP-1, utilize it maybe in microdosing or smaller doses just to acclimate that glucagon receptor again so that you're burning fat again and you're regulating glucose much better. But then maybe you can wean off of that or have a reduced dosing schedule of it, right? So I think that's the biggest thing that patients come to is just all the questions about safety, use, how long. I mean, they aren't cheap, right? I mean, and I try to discourage people from doing too many things at one time, right? Because I think you need to give your body, order and structure and signaling and watch for the signs of improvement, measure the signs of improvement. Is the peptide you're using benefiting for you? Because if not, then, okay, let's try another approach, right? And I've also found that it's always better if you combine peptides with nutrients. It's one thing if I want to try and heal the gut, but if I can give you some glutamine and knock off some of the bad bugs and maybe give you some beneficial flora, I'm going to allow that peptide to really maybe accelerate its capacity to do the good it was meant to do. So I've always been very big on teaching the complement or what surrounds that peptide's function with adequate, nutrient status. Are you overtraining, for example, or not? What are the rate limiting steps that would limit the success of the peptide?
And I think that's a great way to look at peptides because there is a context around the effectiveness of the peptides. And one of the big things is the behavioral component, diet and exercise. I want to postulate two examples. One would be, let's say, a patient on a GLP-1, let's say semaglutide, and then let's say a patient on a combination of testosterone and sermorelin interested in recovery improvement. How would you assess in those two situations, and of course just generally speaking, how would you assess the behavioral component, let's say for the patient on the semaglutide versus the patient on the sermorelin with the testosterone? What behavioral factors are you really trying to look into to make sure they're maximizing the effect of the peptide?
Well, I mean, for one, on all the semaglutide or any of the GLP-1s, is what's your food noise like? Is it driven by stress? Are you a dopamine deficient individual that is getting triggered emotionally to eat? And even though you're nauseous right now, as soon as you go to get off of it, the food trigger, the emotional part is still there, and now you're back into that old habit, right? So from my standpoint, what I'm looking for in individuals is that willingness to change their lifestyle. What is your willingness to change what you're doing in order to get better results? Because we've already seen the stories of people utilizing something like semaglutide to lose 30, 40, 50 pounds. They get off of it. They think they've hit Xanadu, right? I'm in my spot. This is awesome. And then the weight starts coming back when they get off of it because they haven't adopted exercise. Because let's face it, at least from the exercise perspective, when you talk to fitness professionals, three times a week, at least 30 minutes of strength training, resistance training maximizes your benefit. So you got to be willing to exercise again if you really want to get the maximum benefit. Same thing, diet. You're gonna have to eat. So the biggest problem that occurs in these individuals and why we counsel them is they turn off that food noise and now they don't eat at all. And now you're going to lose 30 to 40% of your weight is going to be lean mass loss. Whereas if you exercise and get at least 1.2 to 1.6 grams of protein per kilogram body weight, so you're looking at about 0.8 grams per pound, 0.6 to 0.8 grams per pound. Now that can become a challenge. So now you got to get into motivation of, hey, if you can't eat 2 or 3 times a day with a full piece of meat, chicken, fish, whatever, got to get the protein shakes in, got to get the protein powder in some way. Now on the person with testosterone and sermorelin, they're a whole different mindset. That individual's going, hey, I want my body composition back. Typically when they're searching out for sermorelin, I want my testosterone back. If it's a man, for example, self-esteem's down, body comp has changed. They get a little bit of that, what I call the whatever syndrome, right? Their mood drops and their motivation's not there, right? And they're achy and that kind of stuff. And so, and then with the sermorelin, I mean, getting that signaling back of the circadian rhythm to improve your sleep, that's more, I'd say, kind of like age or stress driven. Whereas the GLP-1s, when people are out looking for that semaglutide, that psyche is because for the most part, these are people that have kind of got ground into overeating and inactivity, developing insulin resistance, right, from that. Too many carbs, too many sweets, not enough activity. Whereas that person that's reaching a lot of times for the psyche of that person on the sermorelin and testosterone is more of a longevity. I want to improve my health span. I want to improve my vitality. I want to improve my longevity. So they're reaching for those a different set of tools out of that toolkit. Because you could do sermorelin and testosterone and not lose a lot of weight. Sometimes you do, right? But you may not.
Yeah.
I like using sermorelin with GLP-1s. I think they're
Yeah.
a great combo together.
I think you had mentioned that the semaglutide with the sermorelin and a possible AOD peptide stack, which is actually the first time I heard that from you.
Yeah, exactly.
So, touching on these two case studies, what I found very fascinating about your response was just how much behavioral driven your therapy is and how much goal driven your implementation of clinical care is. It's almost as if you have a defined starting point and defined end point, and really the peptides are helping to get from that A to that Z. It's almost like you're a behavioral economist in certain ways, right? You're like nudging towards a particular outcome.
That's, you know what? Nobody has ever said that. But I got a bachelor's in pastoral wellness, and so I do a lot of I like goal setting without calling it a goal.
Hmm.
I want people to go on a journey to heal. But that journey has a defined beginning and a defined end. And when we get to the point where we hit that journey, are we going to start a new journey? Like you've lost your weight, or now we got your testosterone back, you feel good about yourself. Are we going to move more to longevity based? Are we going to look at detoxification? What's the next step or evolution in you reclaiming your metabolic capacity? Right? I think what peptides do is they do a great job sometimes of putting band-aids on bullet holes, right? It's like we get started and it gives people the motivation to change the way they are behaving. And now our job is to help reshape them through guidance,
Yeah.
not through finger pointing, but guidance, right? And get them where they want to be, not where we want them to be. Because I'm a Spartan. I mean, I'm in my 60s. I still want to hit the gym pretty hard. I mean, people look at me and go, "Man, you do way too much," right? That's what I love,
Yeah.
right? Other people, well, maybe they love gardening, but they just don't want to hurt when they garden, right? So we got to always be respectful of that.
Yeah. And so, going along that vein of peptides is almost kind of like it lowers the barrier to entry to make a certain change. You start to see a lot now on peptide stacks where people will say, "Hey, I'm going to stack these peptides," and oftentimes it's forgive me for coming across a certain way, but I think that it's kind of a term that's used in haste, if you will, because it's kind of got this connotation of being something innovative and new, but it's definitely something that people have not explored as well as we should have, both on the provider side and on the patient side. So when a person comes to you and says, "Oh, I want a peptide stack to build muscles," or "I want a peptide stack for longevity," and you saying earlier in the conversation about starting slow and steady, maybe one thing at a time, how do you convey to people that hey, maybe a peptide stack is not the best way to start, but it could be the way to go, but let's start a little slowly? How do you phrase that conversation?
Yeah, I mean, the way I start every conversation is pretty basic. I start with, we're gonna look at your labs and we're gonna do a really good assessment of how you feel. And we're gonna start the plan to rebuild your metabolism step by step. And we may need a peptide or two. There may be a bioidentical hormone. It may be all nutrients and behavior modification, but we have to do it in a logical way so that we're building the foundation of when you do want to add, a stack, that you actually get more benefit. And I mean, I honestly discourage people from doing more than two or three peptides at a time. I mean, I just think that for one, what we're starting to see now is people are getting, pincushion fatigue, right?
Mm,
They're
yeah.
just getting tired of. I just don't want to do so many shots anymore. And remember when it first came out, people were doing 3 times a day, 4 times a day. They're doing 5 different peptides, whatever, right? I
Yeah.
never was a big fan of that because I just knew at some time people would they would stop seeing the shiny object as being
Hmm.
shiny versus it being a therapeutic tool that we're using to create a goal, right? I mean, one of the things that I'm really big on right now is other delivery systems. So, we've developed this liposomal tablet that keeps peptides in under 100 nanometers in particle size And we're seeing that have a dramatic impact on being able to take it orally, chew it up and absorb and get the impact that you typically would only expect from an injection. So I think, that's going to help that whole process along. But I still go back to your body can only handle so much information at one time. It's one thing, like I can tell you there was an acute case. Somebody was in a personal watercraft injury, rope tied around their leg, basically shredded their leg. They were going to lose their leg. The family called me and said, well, what would you do? I said, well, you're in ICU. There's nothing you can really do in there. They're like, well, what would you do if you could? And so I gave them several things that I thought would help with the neuropathic pain, restoring nerve conduction, reducing inflammation, try to signal the muscle and bone to rebuild. And he didn't lose his leg. And so
thank God.
he needed, in an acute situation like a crisis, I think that's when, hey, you can really hit on a lot of different cylinders. But what I find is that people end up thinking that, hey, if I do these peptides, I don't have to watch my blood sugar as close because I'm doing this anti-aging peptide, or I don't have to look at my kidney function. And I see people coming into me with this big list of, peptides and novel compounds and rapamycin and all this stuff. And you look at their labs and go, yeah, but you have a 97 blood sugar. And you're already damaging your endothelial cells. And you have a 72% risk of being a person with diabetes in the next 10 years. So creating value and the application is what I try to explain to them.
Yeah. No, that's well said. Let's transition and maybe talk a little bit about your journey from, as you had mentioned, the clinic, academia, now co-chair of A4M, involved in work with a very large corporate gym, which I'll let you kind of explain going further. Sure. Is that a natural progression of how healthcare has evolved from the traditional clinic and academia to a more functional, if you will, a more real-time applicability?
Well, being in it for 40 years certainly has afforded me, and I was very fortunate to get in it right. I'm 23 years old and I jumped in this, full tilt, right? I've had 40 years of seeing things, and I would say that there's been an amazing transition, even though I would always love to see it go faster. It's the old saying, new ideas don't get accepted, old people die.
Yeah.
Right?
Science advances one funeral at a time, Max Planck. Yeah. Yeah.
So, I think it's been amazing as a journey. When I first started out, and I was, a professor at the University of Cincinnati College of Pharmacy and College of Medicine. I was appointed adjunct faculty. I was a preceptor because my clinic was so big. It was, the attitude was, I cut chicken heads off and swirled them around the room. Vitamins made expensive urine. There's no value to vitamins. What are you talking about? Slowly over time, writing, I wrote databases for the American Pharmaceutical Association and Lexicomp, 240 rubrics for treating diseases inclusive of drug therapy plus nutrients. That was in one of Lexicomp's databases, the drug-induced nutrient depletion database, and bringing awareness of that. I kind of found that I had to build the value of integrative care one block at a time. So starting with the value of drug-induced nutrient depletion, even though in my personal clinical practice, I was, doing detoxification and understanding the relationship between adrenals and blood sugar and, adrenals and brain health and gut health. I was getting that information from docs in Germany that were training me. Understand that even when I wrote the book, Cracking the Metabolic Code, 20 years early, right? A lot of people looked at that book back in 2002 and were like, wow, that's really far out. But now, everybody slaps me on the back and like, man, you're lucky to be where you're at. And I'm like, yeah, 40 years lucky.
Yeah.
I've been at this. So
40 years to be an overnight sensation, huh?
100%, right?
Yeah.
And I think that there's going to be this tremendous acceleration and acceptance. I've seen such a generation of young physicians that are embracing this more complete model, what I'd say a full thought model towards what healthcare is, where it's just good. I just call it all good medicine. Like I never I never wanted people to call me functional. I never wanted people to call me regenerative. I never wanted people to call me, integrative or regenerative, whatever, holistic. I just wanted people, at least from my view, to accept that I'm giving them evidence that helps their people, and that's good medicine. And as a pharmacologist, here's the receptors that get affected when you use this herb or this nutrient, and here's what you're attacking, and why don't you measure the outcome? And let's let the outcome dictate the value,
Yeah, love it.
right?
Yeah.
That's kind of been just the way I've always approached it. I mean, even the way I teach, I mean, I kind of just do it the same way. I just teach practicality.
Yeah. No, that's certainly amazing. With the limited time that we have left, I want to conclude with maybe one or two questions, really just getting a sense of what you believe the next year and the next 5 to 10 years will hold. I think you and I both are in agreement that this is going to become a big part of just basic primary care, outpatient primary care. That as a physician, this notion of seeing a patient for 5 minutes, refilling the medications, asking about their kids, and then calling it a day is just not cutting it, right? And I think the pandemic has made evident what was always present in the mind of patients and providers, that we want something more. At the vantage point you have and with the experience that you have, what does the future hold in the next year, in the next 5 to 10 years, if you had to put your crystal ball hat on and just kind of
Sure.
share the audience?
Yeah. Well, I mean, the first thing is I always believe that this should have been in the hands of physicians and people in primary care, family practice. Docs are so well trained. We just have to give them the other set of tools, right? I mean, they know. I mean, I've never pretended. I'm not a medical doctor. I've taught at medical school. I teach a lot of medical docs. I know chemistry. I know how to work on people, but the training doctors get, it's so insightful. And so that's the first thing, is that I think over the next 5 years, we're going to see the role of the physician become greater in everyday health for their patients. I think that what's going to happen is, look, for all the insights of ChatGPT and AI, quantum computing, we still don't even have good magnesium adequacy in people in the US. And we're
I
all
know.
talking about this stuff way up here. And I know, I mean, I invented a cloud-based informatics system. I mean, Metabolic Code is a cloud-based informatics system that is modeled to predict all kinds of cool stuff. But I think the implementation of utilizing those tools so that the healthcare provider can give better, insightful, and more accurate information. So what's going to speed this process up is that layering of AI onto a good system. It has to be a good system to start. You can't just ask AI, hey, give me an integrative approach, ChatGPT, give me an integrative approach to my colitis. You get
Yeah.
48 pages and you don't know what the heck you got, right?
Right.
What do I do? What do I don't do? But once you get those good rules in place, I talked to a leading AI scientist, and it blew my mind because we never thought of it this way. He said to me, you know what? It's 20 years doing AI, this scientist, by the way, in healthcare, right? Did the Stanford heart flow model, Page cancer diagnostic model, brilliant guy, Leo Grady. He said, what we found out on the Page program was that we could take a brand new oncologist and make him create decisions and outcomes that would match up with the oncologist that had 20 years experience. So what AI will help do is, if we give it good information on the integrative medicine side, on the wellness side, on the prevention side, on the nutrient side, on the peptide side, is the beginner now starts to become an expert more quickly. And that's what I'm excited about, because we have a lot of people that need that help.
Yeah.
Right? That's so if I look over the next year, we're going to be tooling up for that. Over the next 5 to 10 years, we're going to have a greater capacity to take all these tools like peptides, bioidentical hormones, nutrients, diet therapy, mindfulness, all of that, going down this collection, and be able to really create something appropriate that creates results. Because in the end, look, I make no bones about it. When I'm teaching, I teach providers this. You have 4 weeks to get someone feeling better, period. If you're going to give them a program that says, hey, I'm going to detox you, you're going to feel like crap for 6 weeks, you're going to be nauseous when you do this tirzepatide, but believe me, it's going to be good for you in the long run, right? Any of that, it just doesn't transfer. When a consumer feels better, when a person goes, man, I loved what that doc did with me. Now you got a partner in health. And that's what you're looking for. You're looking to be on a journey with each and every one of those people because you'll learn from it too, right? So that's my put my big hat on. Yeah, we'll find new peptides, we'll find new molecules, but you know what the other problem with that is? We're going to spin out 100 new molecules using AI or using quantum computing. And it's like, okay, so what? What do I do with them, right?
Yeah.
So there's all of that we just have to ferret out and make sense of. But I think it is, I wish I was 30 years younger.
Because the future is bright. No, it's definitely a blessing to be in this space, and Dr. LaValle, is definitely a blessing to be in touch with you because just the insights, learning from you, from A4M, it's really gonna guide the next generation of physicians to understanding this space, and I couldn't be more grateful to have you on this podcast.
Oh, Jay, it's my pleasure. I loved it. I mean, hey, you know what? We swam upstream pretty darn hard.
We did.
This was a lot of fun. I'm so grateful that I got to be on your show.
Well, thank you, sir. Appreciate your time.